Hi everyone. Today, we will be sharing some useful information on ingredient safety in complementary health products, or CHP. From this video, we hope you can learn more about the importance of ingredient safety, how to identify an ingredient and how to support their safety, using literature references or scientific data.
Good morning, Henry. What are you up to?
Hey Phoebe. I was just looking at the sales of our CHP last month. The vitamin supplements and herbal products seem to be doing okay. But maybe it's a good time to introduce a new product since holidays is just around the corner?
Guys, I just saw online that this new product called Stomach Good is very popular in the US. Let's contact the overseas product owner and have it imported into Singapore right away.
Hey Charles. That is interesting to hear. What do you know about this product?
I am not sure what the product contains. It's in a capsule form and is widely consumed in the US without serious adverse effects reported.
That won't do. It is important for us to identify all ingredients of the product and establish if these are safe and allowed to be sold in Singapore. CHP contain many different ingredients. Some ingredients are added to deliver a specific function, while others are added during manufacture of the product. As dealers, we should not only supply products that work to the consumers. We must also take the responsibility to ensure that the products are safe for consumption. There are many considerations when it comes to product safety, and one factor would be the safety of each ingredient. The first step in ingredient safety is to find out what the ingredients are. Let us use the example of a capsule. CHP typically contain herbal ingredients or extracts of components from natural sources. Don't forget about the capsule shell, which would also be part of the ingredient composition. The ingredients which make up the capsule shell would be considered inactive ingredients. This includes shell colorants such as iron oxide, and also ingredients like gelatin and HMPC, which forms the structure of the capsule shell. Other ingredients that are added into the finished product such as emulsifying agents, flavoring ingredients or preservatives would also be considered inactive ingredients. In short, anything added into the finished product that does not contribute directly to the product's intended function would be considered as an inactive ingredient. If the ingredients are intended to provide the purported health benefits, which in our case would be ingredients added for digestive health, these would be the active ingredients. Active ingredients in CHP should be derived from natural sources, such as plants, animals, or minerals. This includes extracts and isolates of bioactive substances. Synthetic sources of these substances may also be used in CHP. The role of each component would help us identify if it is an active or inactive ingredient. For CHP in particular, the active ingredients must be from natural sources. Whether it is active or inactive, we need to identify it and support its safety. We will focus on identifying the active ingredients in our product, plant Y and extract A. Ingredients which are of plant or animal origin may be identified with the following information. The scientific name, which includes both the genus and species of the organism, helps us to distinguish the ingredient from other ingredients which may share the same common name. Some plants and animals have adopted multiple names, and these synonyms will be helpful for us to identify the ingredient. Common names allow us to know what these ingredients are commonly known as. Finally, a general description may provide information such as its appearance, where the ingredient is found, how it is obtained, and how it has been commonly used. Information on the part used, manner of extraction and standardization to a constituent is also important in identifying the ingredient. With all the information in place, we have successfully identified the plant or animal-sourced ingredient. chemical isolates can be identified with the Chemical Abstract Service, or CAS, number. The International Union of Pure and Applied Chemistry name, and its chemical structure, help to specifically identify the chemical entity. This can be supplemented with any other names which this ingredient may have adopted. This typically refers to the common name for chemical isolates. With this, we have successfully identified our chemical ingredient. After we have identified the ingredients, we should first do a check to make sure that they are within the scope of a CHP ingredient, as that it is not found in any of the negative ingredients lists, such as the Poisons Act, or the ASEAN negative list of substances for health supplements and traditional medicines. Identifying an ingredient is not just about the name. There are other components of an ingredient that contributes to its identity. Only by knowing what the ingredient is, can we ensure whatever safety information we use is for the same ingredient in the product. Now that our ingredients have been identified, it is time for us to check if they are safe. How do we go about it?
The first place to source for information on ingredient safety are literature references of safe use. We can check if our ingredient has been assessed by regulatory authorities or scientific bodies. For example, Health Canada publishes ingredient monographs for ingredients which are allowed for use in their natural health products. The Therapeutic Goods Administration of Australia publishes a list of ingredients which they have assessed to be permissible for use in their listed medicines. Unfortunately for us, we have not been able to find assessment of our ingredients by regulatory authorities or scientific bodies. Another source of literature references are that of recognized reference books. This includes Materia Medicas and Pharmacopoeias. In this example, we have managed to find information about plant Y. From the information in the reference, the plant part used is the leaf, which is the same as what is used in our product. The product is intended for digestive health and contains plant Y as active ingredient. The documented use of plant Y matches the indication on the product. Most importantly, the maximum daily dose of plant Y is 2.5 grams a day. This is within the recommended dose documented in the pharmacopoeia. As such, the history of safe use of plant Y in our product has been established. Even though the ingredient is documented in literature references, we must always take note of any maximum daily limit that HSA has in place. We must also label our product with appropriate cautionary statements to allow consumers to make informed choices of their purchase. Majority of the ingredients used in CHP can be found in the recognized reference books or in assessments from other regulatory authorities. However, documentation does not guarantee safety. We must remember to use the ingredient at an appropriate dose and label the finished products accordingly. Now that we are done with plant Y, it is time to deal with extract A. As we could not find any records of extract A in the literature references, the next step is to use scientific data. So what kind of scientific data do we need?
There are a few indicators which we may examine from animal studies. One of which is any possible adverse effects as a result of exposure to a substance from a single exposure or from multiple exposures in a short period of time. Mortality is often used as the main observational endpoint for such studies, and observation of the test animal usually lasts for 14 days. This is known as acute toxicity. It is used to determine dose of toxicity or death and helps to determine diagnosis of possible overdose. There is also a need to characterize the adverse toxicological effects which occur as a result of repeated daily dosing of the substance up to the expected lifespan of the test species. Generally, a control group, along with at least 3 test groups, should be administered a range of dose levels, with the highest dose level selected with the aim of inducing toxic effects but not death or severe suffering. Descending dose levels should be selected to demonstrate any dose-related response. The highest dose in which no adverse effects are observed in the test group is the No Observed Adverse Effects level, or NOAEL. The duration of the study depends on whether the product is intended for long-term consumption, but should minimally last for 28 days. This is known as repeat dose toxicity. This study is especially important for CHP as the product is usually taken for longer periods of time. The study helps us obtain the NOAEL, which will help to derive the acceptable daily intake of the ingredient. This would also help to establish an appropriate starting dose in clinical studies. Other than animal studies, there are other studies which are also important in determining the safety of an ingredient. Genotoxicity tests are intended to detect any potential of induction of genetic damage. Should the product be recommended for daily use for more than 6 months, carcinogenicity studies will be required. This study is to determine the tumorigenic potential of an ingredient. In other words, how likely it is that the ingredient can cause the formation of tumors. Similarly, if there is a cause for concern regarding reproductive toxicity, or the product is intended for use during pregnancy, lactation, or in children below the age of 12, reproductive toxicity studies will be required. As mentioned earlier, we have obtained the NOAEL from the repeat dose toxicity studies. One way of determining the acceptable daily intake of extract A is by dividing the derived NOAEL with an uncertainty factor. Many considerations affects the calculation of the uncertainty factor, but typically it takes into account interspecies and intraspecies variation. However, a calculated acceptable daily intake from animal studies alone is insufficient. Human safety studies would be required to support the safety of the ingredient. Should this not be available, good quality human efficacy studies may be provided to support the safety of the ingredient in human. The efficacy studies must include relevant safety information to be used to support the safety of an ingredient. This includes adverse event reporting and analysis of key hematological parameters. With these scientific data, we have successfully established the safe dose range for extract A. There seem to be a lot of scientific data required, but looking at the rationale of each test, they are indeed necessary to ensure the safety of an ingredient. Whether it is active or inactive ingredients, safety of each component of a product is equally important. We must ensure the safety of our product before supplying it to the consumers, and ingredient safety substantiation is one of the steps in doing so.
The extract A seems to be a relatively new ingredient. However, now I am sure this is good to go. I will contact the overseas product owner on this. Great job, team.
We hope this video has helped you understand the importance of ingredient safety, the scope of ingredients used in CHP, and also learn more about safety substantiation of a CHP ingredient. For more information, please visit the HSA website and refer to the guidelines for establishing the safety of ingredients. The guidelines can also be accessed using the QR code in this video.